This is almost it. This is the last round. We'll do module 6 and 7, then we'll close out. So module 6 is observing achievement of results using scales and matrices. The objectives are participants learn the process of creating an outcome scale. Participants understand how outcome scales can be used to measure incremental change and movement towards self-sufficiency. Participants are able to combine outcome scales to form an outcome matrix to capture multiple interventions, needs, programs, and outcomes. Participants understand the uses of the outcome matrix and can analyze an outcome matrix. Okay, the introduction to outcome scales. This is an introduction to a scale. You see that on your page? Anyone can identify with that? I'm sorry, page 78. Yeah. You see that scale? What would you identify that scale as?
Old gas you have.
Old school gas.
Right. We've all seen those before. We know it's making reference to, even if it's, you said old school gas gauge?
Yeah. Because now it's
My car must be really old school then.
I
My
know,
gas gauge
some
looks
of us
just
may
like
not be
this.
old enough to have seen it before.
Well, mine
Right.
was the E part.
The E part.
The E part, mine looks just like that.
Okay, this is the introduction to scales, and it's a follow-up to the discussion we had back in
He
module
dropped
3
the jet from
about
the car.
change in status and change over time. So what better identifies change in status and change over time? You know when your gas goes from full to half the tank and from half to E. You can see that change over a course of time. An automobile gas gauge is one example of a very simple scale. Go, you on page 78? Someone read the gray area?
Outcome scales are used to identify and measure incremental change.
Right, the meaning of these benchmarks might vary. And also I want to ask you, why do we keep our eyes on our gauge? Why would we watch?
So we don't run out of gas.
So we don't run out of gas. So when do you start looking at your gauge?
Fill it up.
So as you fill it up, you look to see where it is,
Yeah.
like every 10 seconds. Anyone wait until it's
I wait till the light comes
close?
on.
Okay, so
Yeah.
some of us wait until it's
And then I
at
see
E.
how far I can go.
Oh, okay.
what
That's
is
right.
excitement.
you are, Amy.
Okay, a reason that you may do that is because of the way the way you transport yourself. Maybe you don't have far places to reach.
Right.
So
I know
you
where
can
the gas
make it-
station is.
You know you can make it 10 more miles on E because you have 5 gas stations in your neighborhood.
Exactly.
What about someone who lives out in a rural area? When would they may start looking at their gauge?
Oh, at a quarter, I
Quarter.
think too.
Half or a quarter.
That's still kind of low to me. Quarter tank?
Oh, yeah.
In the rural area?
In a rural area?
I
I
look at
can't
half.
make it home and back.
On a tank?
On a quarter.
I can make it home and back, but just barely. I don't like risk.
On a quarter tank?
On a quarter.
Oh, okay. So we all have reasons as to why we look at the gauge at different times. Some of us just like to take that risk. Say, I know I can go 3 more miles. I know I can make it on E.
When the light first comes on.
I know people who, once they get to half, they feel like it's about to shut off on them, so they have to go and fill it back up to full. So you can't let it go back below half.
I drive a gas.
That's your benchmark you set. When you see it getting close to that line, you go in and put it back up.
Takes too much time.
The second gray area at the bottom says, it can be used to identify and assess or measure incremental change in families, agencies, and communities also. So a scale can be used to identify when change occurs. Okay, over on page 79. Scale methodology developed by the Monitoring and Assessment Task Force. Y'all ever seen those terms there? Anyone use Facts Pro? Do assessments? Thriving, safe, stable, vulnerable, and in crisis. Because I want to read that first paragraph up top.
The 5-point scale template was developed by the CSBG Monitoring and Assessment Task Force in the early 90s. The MATF provided some examples of scales, but it did not define the benchmarks to be adopted by all CAAs. The MATF believed it best to have the outcomes associated with each benchmark to be developed by local consensus, which served to define the terms.
Great, so we have a universal scale in that the benchmarks are labeled thriving, safe, stable, vulnerable, and in crisis, but for each CAA, it's up to the CAA to determine what they consider thriving, safe, stable, vulnerable, and in crisis. So let's just identify full. What would full be in that scale?
Thriving.
Makes sense. Okay, and what would 3/4 be? 3/4 of tank.
Safe.
Okay. And what would half a tank be?
Stable.
Stable. What would 1/4 of a tank be?
Vulnerable.
So vulnerable. And what would E be?
Crisis.
Me.
Red light.
So riding on that light may be a crisis situation. What if there's no gas station anywhere close by? You could be in a crisis situation.
Taking your Winn-Dixie car. Go to another shell, if that happened.
Okay, you see the prevention line that's on this scale, on 79? Where would we put that prevention line on this scale?
Gas buddy.
Like, where would we put the line on this scale?
Between stable and vulnerable.
Right. You see how the gas gauge scale can correlate with the scale developed by the task force in the 1990s? Okay, it's a gauge. This prevention line is at a place where we can gauge where we should intervene. Should we intervene on someone who's in a thriving situation? Like, what reason would we have to intervene? But someone who moved from thriving to safe, we may want to observe. But what about stable to vulnerable? Yeah. Okay, can someone read that paragraph at the bottom there? Just more information about benchmarks at the bottom of 79.
I'll do it.
Okay.
Early work in creating samples of definitions associated with scale benchmarks in multiple domains was done by Frederick Richmond. For example, the Family Self-Sufficiency Scale was developed in Pennsylvania in 1995 by the Bucks County Opportunity Council in Richmond. The MATF, Scales and Ladders Committee, and others throughout the country, such as the Illinois Community Action Association, also worked on providing local agencies with sample scales beginning at that time.
Thank you. I like the importance on this page, even though it seems like a bunch of information. It's just good to know that it's based on something that was developed by community and also has been proven to work. Over on page 80, we're actually going to do an activity of developing our own housing outcome scale. So we're on page 80. What are possible kinds of housing situations in your community? Could someone scribe for me? We'll just write out what those different outcomes. Really? Thank you. Okay. So right now we're gonna jot down some ideas you have about a housing outcome scale.
Adequate, safe, affordable housing.
Okay. Adequate, safe, affordable. Adequate, safe, and affordable housing. Adequate, safe, and affordable housing.
ADQUATE.
Okay, any other ideas? Types of housing that could fall on this scale. Types of housing.
Tornado.
No, types of housing, the actual housing
Disappear.
situation. So
Homeless.
if it's safe and affordable, homelessness.
Disappeared.
Okay,
Yeah.
I heard homelessness. What
At
homelessness?
the bottom. All at the bottom.
What you say?
String.
Homelessness. Types of homeless.
Destruction of home.
The actual house is type of housing that we have. So if affordable housing is an option and homelessness is a type of housing, what types of
Are you talking
housing?
about like single family home, multi-family
Or are you
homes?
talking
Or are you
about like
the
dilapidated
conditions of
houses?
the
The
home?
situations like a homeowner, a renter, someone
Oh,
who is
okay.
homeless, someone who has safe and affordable housing, or someone who has
No home now.
no home at all.
Yeah.
So that would be full, and then
On the bottom would be
E
home.
would be.
Well, we hadn't gotten to that portion just yet.
Yeah,
Oh,
But right now,
okay.
just
Oh,
different.
yeah.
So
Throwing it out.
someone who's
Okay.
housed,
Hold on.
but they can't afford their housing. So
Not
they're-
necessarily housing. What are types of housing? That make more sense. What are types of housing?
Apartment.
Okay, apartments. That is a
Oh.
type of house.
Oh,
Housing. So apartments.
Single family home.
Put homelessness. I'm
Mobile
sorry.
home.
Hold on, y'all. Hold on.
Shelter.
Because
Sorry.
we've told them 3 different things now.
Yeah.
So safe, affordable housing
Uh-huh.
is a type of housing.
Or
Homelessness is a type of housing. You don't have a house, it's a type of housing.
temporary shelter.
Just in
Yeah.
apartments, temporary shelter also, but apartments,
Yeah.
types of homes.
Mobile home.
Temporary shelter. Mobile home,
Apartments, condos.
Single family home.
You said mobile home?
right, mobile home. We have apartments, If there's adequate, safe, and affordable housing, what's the opposite of that? Or what's another option? If it's not safe and affordable, it could be.
House poor.
Expensive.
Slum grade.
There you go. So, slum. What about slums? We know what slums mean, don't we?
Yeah.
We all agree slums is just a bad area.
Yeah.
Okay. So slums or
How about living with relatives?
right, living with
Yeah,
relatives
I was
is
gonna
a
say
form of housing.
Which can be a form of homelessness depending on the definition.
Yes, exactly.
It qualifies you for Head Start, which is how Emily got it.
And to go to school when you have it closed on your house.
Okay. Well, I haven't heard the most.
I mean, it could be.
Okay. Home ownership.
If it puts
If you own a home,
single-family
that's a type
homes
of-
up there,
Man,
single family house,
single family home.
individual ownership.
Yeah.
That was-
So ownership.
Right.
Okay. Ownership. Home ownership.
Okay.
It's still not clear. Okay.
And is it-
We're developing a housing outcome matrix, and we just went through a gauge of how someone can be this housing. So a thriving housing situation would be home ownership. That's just an example I'll give you. I wouldn't believe, let's see, safe, stable, vulnerable, and in crisis. So on this range, in a housing situation,
So you mean like rental? Like,
right,
okay.
a type of housing situation.
So it wouldn't necessarily be apartment, but if they were in a rental situation.
I was trying to get there.
instead of-
No one
instead of
said it, but apartments sound like rent.
Or
So,
like lease purchase.
right, lease.
Yeah.
Mm-hmm.
So lease to purchase,
Okay.
home ownership, lease to purchase, I'm sorry. Poor scribe, sorry.
He's a good one to do it though.
Lease to purchase,
Access.
home ownership.
Access.
I don't wanna continue if it doesn't make sense though.
Foreclosure.
There you go. It's a type of housing. Foreclosure. So you're a homeowner, but you're about to lose your home. It's a type of housing. Not how the house looks or if it's brick or wood, but housing situation, your status. Oh, that's good. That's a good
Status.
start.
You got it.
Housing
I'm with you.
Housing
Living
status.
Living it.
Okay.
Living it.
Yeah. See different regions. I've never had. Okay. I learned something. Okay. I'm write that on here too. Housing status. Okay. Okay. Now this. Okay, so if I turned in housing status, these options make sense now?
Yes.
These are different housing statuses.
Because
different-
that's what I was trying to do, actually. I was trying to do this before that.
before this.
Or do it all at once.
So a housing status would be adequate, safe, and affordable housing. And it's good to know if you use Facts Pro when we do the assessments of a household, it gives you a lot of these different options as someone's housing status. So homeless, apartments, temporary shelter, lease to purchase, home ownership, foreclosure, living in slums, and mobile home, living with relatives. Okay, so which of these we consider thriving?
Ownership.
Any others?
Could be.
Just think about your community.
It could be rental, depending on.
Lease
Well,
purchase.
at least the purchase might be more safe
Yeah, it would be more safe. to-
thriving.
So what's the agreement on lease to purchase? Who agrees that that's thriving?
No,
might
we
be
said
safe.
lease to purchase was safe.
Safe.
Oh, y'all moved on. Okay, hold on. Maybe
Home
put ownership.
Home ownership is thriving.
Okay, and it doesn't have to be one. Whatever you would. Ownership. Okay.
And you know, you own a mobile home. too, that's-
Right. So what I was asking was, okay, for thriving, any others that would be thriving, based on your community, the people you deal with, and you would consider thriving.
Renting could be
Right,
thriving,
yeah.
and it depends on that family's.
Yeah.
We're trying to get a consensus. Though anyone else agree that rent could be thriving?
I do.
How many people? Raise your hand. Okay, well, majority wins. It's not going to be thriving right now. What about safe?
Rent to own,
Rent to own.
or lease to purchase.
Yeah, LP or Jamaica, rental or LP.
We said rent to own? We
Yeah.
said lease to
Lease
purchase.
to
Rent to own.
purchase, but go either way.
Same thing.
Well, you know, different rules with rent and leasing in some places.
Yes.
I thought.
Yes.
Okay, lease to purchase. What else could be safe? If there's anything else. What's
Rental.
safe?
Renting.
Okay, and we said apartments, but we're calling this renting also, I think, because
Yeah.
we have a better understanding.
Yeah, 'cause you can rent a house.
Yeah.
To rent a mobile home.
Yes.
Yeah,
Exactly.
yeah, yeah.
Yeah.
So you're considering that safe,
Mm-hmm.
okay? Anything else safe? Okay, what about stable? You're stable? And remember, this is before the prevention line, this is before you would have to intervene. So what all on here you would consider something that before you would have to intervene?
Either rental or lease purchase in a neighborhood that is not as safe.
We've already identified those two, so we can't.
Alright, so mobile home living,
Okay, anyone else agree with mobile home living?
would be stable, I mean, it's a
People
form of
purchase
renting,
there
or it could be
Yeah,
owned.
you know, we can tempt you.
and have every desire to live
Yeah.
where they live.
Yeah.
And this is based on y'all's community, what you agree with. You know who owns mobile homes, if it's in a safe environment, if it's stable, if that's a stable housing
Except the
situation.
tornadoes.
I mean, I would say that's
Mobile
stable.
homes are stable.
Yeah.
So mobile homes are stable? Can we count? I can't tell who's talking.
So,
I actually think they're safe.
Can you raise your hand if you say mobile homes are stable? Well, we didn't have enough count for safe because we're trying to be in agreement.
Yeah.
So we didn't have enough for safe. So if you voted for safe, you can vote for stable now.
Oh, well, wait a
So how
minute.
many people? There you go. Thank you.
Sticking.
Okay, so mobile homes, because you own those mobile homes. This is the idea that we have with the mobile homes on this list. They're owned, right? Because you could be renting a mobile home also.
so they would either go
There's,
to home ownership or
geographically,
rental.
there's a much higher percentage of individuals in this state and in this area that own mobile homes than in
Okay.
other areas, so
The
it's-
person who said mobile home intended for this to be ownership of mobile home.
Correct.
Okay.
Which is thriving.
I mean, that's different. You could live in, you can be in the area where you're renting the mobile home.
I mean, some people
It's safe-
do rent
it's
them,
safe
but
for
renting is
everything
and
except
ownership are both in a thriving and safe environment, so mobile home, even though it has the same qualities as renting or owning, the reason it would be in the stable versus the safe and thriving is because of the type of structure. So you're more prone to weather
Not as
concerns,
safe.
and, you know, it's not as safe. So you have issues that might knock it down from considering it thriving and safe, but it's still above.
Right. I completely agree. But in this session, we're
Okay.
getting the consensus.
Okay.
So the consensus was
So-
homeownership was the only thing that was thriving.
Right.
Safe was lease to purchase and renting. Stable was mobile home ownership. What else could be stable? Oh, homelessness hasn't been used yet, I'm sorry. What's stable? Anything else stable? Remember, we have foreclosure, temporary shelter, slums, living with relatives, and homelessness. Okay, now we're going below the prevention line. What's vulnerable?
Living with
Living with
relatives.
relatives. yeah.
Okay, what else?
Temporary shelter, foreclosure.
No.
Okay, who agrees with living with relatives?
Yeah.
Okay. Okay. Who agrees with, I heard foreclosure. Who agrees with foreclosure as being vulnerable?
That's how it crisis.
Yeah.
Can I see your hands?
I
Vulnerable.
think either way.
So no one, okay. And temporary shelter. Someone said temporary shelter. How many people though? Just one?
I think that's a new price.
Okay, so it looks like
It
everything
depends.
else.
I worked in a temporary shelter. I look at it
We
differently.
didn't put,
Depends
I
on
think
how temporary
slums
it
is
is.
vulnerable. That's just my opinion.
Yes, ma'am. Who else agrees with
You
slums
know
being
what, I
vulnerable?
agree, I think that is a
Yeah.
vulnerable position,
Yeah.
but not in a
Ra-
crisis.
Raise it up. I'm trying to get a count.
Yeah.
Okay, slums, okay. We want to be in agreement as much as possible because we can argue the case for each level, for each of those situations.
Not under the bridge yet.
So everyone else is in crisis. So that's homelessness,
And foreclosure.
temporary shelter. And we have different reasons for foreclosure. Is that all of them? Okay. Oh, adequate and safe, missed that because it's in red. Safe, adequate, safe, affordable housing, where would that go?
We got it already under home
Homeowner.
ownership.
Yeah.
Well, no, that doesn't imply that you own it.
Rent.
You're in a safe area. Adequate, safe, affordable housing.
That's better than thriving.
It is not as specific. It's better than thriving.
That's better than thriving.
Okay. But you're in the community, you're in an area that is safe and affordable. So where would you put that on the list? It's not as specific as the other ones, but
Thriving. Thriving.
there's no over thriving.
They didn't come to see us anyway.
Okay.
Right?
Oh, but you may want to collaborate with them on a project.
Okay, housing. All right, thank you
Wait.
all for yes.
I'll just let it go. It's not worth it.
Okay, we've now constructed a house because we can go back and forth on it.
Yeah.
There are different areas who would, like y'all say, y'all would disagree about the mobile home ownership, but it could be because of the area that you live in versus where someone else lives. Home ownership also, foreclosure. Foreclosure means they're, 3 months behind? At least 3 months, and they are in the process of being evicted. So who knows if they have savings account or another house to go to. These people are likely, depends on the area, close to homelessness. Temporary shelter is somewhat in line with living with relatives. Because that could be temporary. You could have a fight and mom on the street or sister, you had to go to someone else's house. Okay, so we got a consensus. We all are in somewhat of agreement of where those scales or where those housing situations fall. Go to page 82. Just know again, this is only one example. No one's wrong. No one was wrong who said something that didn't fall in the area that they would agree to.
It would depend on your mission too.
Right.
Because if you do homeless shelters, you would not consider somebody in a temporary shelter.
Right.
You would think that you got them relatively stabilized long term.
That makes sense to everybody? Okay. Someone read that top area, analysis of the sample housing scale. Just to reiterate, this is just one example of a housing scale.
Please note, this is one example of a housing scale. It is not to be considered the correct scale, as the descriptors contained in the benchmarks should be based on local conditions.
Okay, thank you. Again, I want to note the prevention line. This is a line drawn, and based on the one that we came up with, this is the line that if crossed, we would intervene. So if this mobile home ownership, if something happened, if someone lost a job, or if they were going into foreclosure, anything that would happen from this stable environment to make them vulnerable and move below the prevention line is when we were intervening. Turn over to 84. Establishing placement on a scale. So like she just stated, if you have a program geared toward homelessness and you want to get people into these different situations, because most would consider homelessness the bottom in crisis. So any of these other situations where they're moving up and achieving benchmarks as they go up would be considered a move towards self-sufficiency. So it depends on the program. Because it want to be the gray shaded area at the bottom.
It is difficult to accurately measure movement on a scale if the initial placement is faulty. You must have a reliable way to establish the baseline.
Correct. An assessment comprised of associated statements will be developed for each outcome scale used in the agency. So each outcome scale would have to be hashed out the way we just did for this one. Each of those would have to be defined, and so from the beginning you would know that if you had someone come to your program, where you would consider them at each of these benchmarks. Okay, on page 86. Using outcome scales. Can someone read that? Well, outcome scales have been recognized for many decades by disciplines in the health and social services fields when it is important to measure functioning and incremental change. Because I want to read that paragraph that's just under there. It's an important example.
For example, outcome scales have been used in mental health to determine if it's appropriate to move a client from a more restrictive to less restrictive setting, or to discharge from a hospital back into the community. The data collected and analyzed from placement on an outcome scale such as this support the management of the patient-client and improve decision-making.
I think that's an important example to note, because I would hope that healthcare professionals, especially mental health, not especially, but specifically in this situation, mental health professionals would have research and experience with when to let someone go from a confined environment to maybe assisted living to being on their own. as opposed to just releasing them when they felt like they were in a stable condition. Okay, someone read the gray shaded area. In community action.
In community action, outcome scales are used to measure incremental change between the scale benchmarks, which allow us to document the movement from conditions of dependency to increasing self-sufficiency.
Thank you. Outcome scales help visualize the big picture of the situation facing the client at the first meeting. Measure change by comparing scale placement at 2 or more different times, indicating positive or negative change, or no change characterized as neutral or stable. Earlier we saw, which module was that? When we first started talking about numbers, and there was 5 out of 20 people who didn't change. They stayed neutral, they stayed the same, but those other 15 individuals had some type of intervention that happened to them. Let's see, can someone read the last bullet?
Support development of a case management plan where the client and worker establish mutually agreeable goals for movement towards self-sufficiency.
Thank you. The graphic nature of the outcome scale makes it an effective tool to help visualize progress towards self-sufficiency. So if you had a client and when they came into intake, they were vulnerable. They were living with some family members, and you were coming up with a plan to help them, and you steadily saw them move from benchmark to go on over the prevention line and get into a safe environment. You're able to document that and actually see that change over time. Okay, page 87. Measuring progress and reporting using an outcome scale. As clients' progress is observed or reported, it's good practice to document this movement by noting the new status on the scale. Consider the kind of evidence or documentation that will be used to verify client progress. It is the individual benchmarks or outcomes on the outcome scale that are reportable outcomes, not the labels thriving or in crisis. Because I want to read that last section. It says, in the housing example.
In the housing example, you would not report that the person moved up 2 benchmarks from in crisis to safe. You would report that the person acquired permanent, safe and secure, non-subsidized housing, a measurable outcome.
Thank you. Many software and electronic data collection systems include scales on, or these can be embedded into the software. You can go over to page 90. Has anyone ever seen an outcome matrix? Anyone does reporting at their agency?
Raise your hands, ladies.
Oh, that's a yes. Oh, I thought it was like, no, we don't do numbers. Okay. As we have seen, the outcome scales help measure incremental change in a single category or domain. Think of the previous example of housing scale. We can measure change by first administering an assessment at the initiation of service results in a baseline placement on the scale. Any subsequent assessment and placement on the outcome scale is then compared to the baseline, which yields 3 possibilities. There's either a positive change, a negative change, or no change at all. In the human condition, we know well-being or achieving a level of self-sufficiency depends on the congruence of multiple factors. At its simplest, an outcome matrix is a grouping of outcome scales arranged side by side. Okay, other characteristics of an outcome scale. Could someone read that shaded area on page 91 at the top? Angela?
Okay. 91 at the top. By using a common framework, outcome scales combined into an outcome matrix can be aggregated and provide a multi-dimensional look at the agency's work. Aggregation is important because it allows agencies to present data on a number of clients and programs in a uniform and quantifiable manner.
Right, it's like a snapshot or a screenshot of that household or that individual. An outcome matrix is used to capture a client's progress, incremental change, capture the data by client across all agency programs and services, in addition to capturing data by each program or service themselves. You go over to page 93. There is a sample matrix. Look like fun, doesn't it? Can we all, do we understand what we're looking at? So we all are familiar with the different domains and benchmarks. You see the prevention line? Okay, this is a sample family outcome matrix. I want to do an activity now. Everyone has a copy, so if we could do 4 groups. Let's get Angela and Stacy to do the income. You see the income domain? And we're identifying changes in status. It says Stacy, right? Okay. Stacy and Angela, you have income, and you're gonna look through and you're gonna identify the changes in that family status in relation to income. Okay, Victoria and Ms. Harris, you do employment. Amy and Louise, is it Lois?
Lois.
Amy and Lois do housing. And Tiffany and Stephanie, you can do education and training. So we're looking at the matrix. We're identifying where we see change in status through those benchmarks.
We're looking at the shade area.
The entire domain, the entire column you're looking at, you're looking at the changes over time. And there should be dates in there. These domains, these 6 identified domains which are across the top: income, employment, housing, education and training, transportation, and child care. At intake, there was a baseline. And on here, February 1st, income shows that this family was between 50% and 100% of poverty by family size. You see that February 1st, income all the way at the bottom. I also had a question someone asked about the numbers that are on here. This matrix identifies, let's see, thriving is 9 through 10. So in crisis is 0 to 2. This family was at 2. You see the 2 next to February 1st? It's not a Roma indicator. I get why you would say that though, because of the ABC. But no, they're not 10.
Yeah, so.
Oh, please don't let them be 10.
Okay.
Everything's in the Roma report.
Oh, okay, I see.
I'll do I should have did one that no one's working on. Okay, transportation, you can see on August 1st in transportation, the family was unstable. And you see the 5 through 6 benchmark that says stable. They identified them as 6 on May 1st. Family members have some transportation needs met through public transportation, a car, or a regular ride. That was as of August 1st on the transportation. Just an example of how you can read the scale, the matrix. Does that make better sense?
Well, I guess my question is, are we starting the year in January, or are we starting the year in August?
February 1st, we'll just assume. We'll just assume.
Yeah,
Okay.
it said first assessment was February 1st.
Right.
Second
Okay.
That makes better sense. Y'all have time, you can keep going. You've identified the 3 areas and where the family was at those 3 different states? Okay. Can we have the income people do
Yeah, we started out in February 1st at a 2, which was the in crisis state.
Okay.
When they were reevaluated May 1st, they'd moved up to the vulnerable state with a 4. And then again in August, they'd moved up yet again to the stable at a 6.
Okay, what else can you see under income if someone is at 6? What does that mean? Can you read the shaded area? What does that say?
Between 126 through 175% of poverty adjusted for family size.
So what does that mean for that family? Do those percentages mean something to you?
More income.
They're above poverty.
Right, they're above poverty, so they no longer qualify for CSBG.
Right.
This is one of those families I spoke of earlier where it may become difficult to do follow up with that family because they no longer qualify for your services. So they somewhat graduated out of CSBG at least. So they're no longer eligible for CSBG, but they did move up and achieve. Let's see, employment. Who's at employment?
That was
Okay.
us.
Yes, ma'am.
On February the 1st, there was part-time employment without benefits. And then, on May the 1st, obtained full-time work at minimum wage without employer-provided benefits. And by August the 1st, achieved full-time work above minimum wage without employer-provided benefits.
Great. Thank you. What about housing? Who has housing?
We do.
Okay.
Okay, so
They were level for February and May.
yeah, so they were vulnerable.
Okay.
4, and it was safe and secure transitional housing, and by August, they moved up to safe and secure subsidized rental apartments, so they moved up to 6.
Okay. Thank you. Education and training.
They had a high school diploma or GED at the initial intake, and that status did not change.
And what does that mean for that household in that category? I mentioned it a couple times.
They're stable.
Right. Nothing changed, so they are neutral. We were neutral, no change. There are some people who won't move from where they are. Okay, that was great. Do I need to go through transportation and childcare? Or it makes more sense now. How you would read it.
Now, yeah.
Okay. Yeah, well, thank you. You all have just received and just gone through a sample outcome matrix. Okay, the key point summary for this section. An outcome scale is a continuum that describes different states or conditions of status. Outcome scales are used to measure incremental change. Any movement in a positive direction on the outcome scale is considered movement towards self-sufficiency, even if the movement is from in crisis to vulnerable. There is a significant difference in outcomes placed in the vulnerable and stable benchmarks. Movement from vulnerable to stable is the transition from dependence to independence. Only one outcome is placed in each outcome benchmark, unless assigned an individual score. By using a common framework, outcome scales can be aggregated to form an outcome matrix. It is the individual benchmarks on the outcome scale that are the reportable outcomes. If the benchmarks on the outcome scale are written in outcome language, they are reportable. If it is not appropriate to report that the client moved up one benchmark on the outcome scale. An outcome matrix is a series of scales arranged side by side. An outcome matrix is used to capture a client's progress, which is incremental change, across more than one scale, program, or service. The outcome matrix is introduced to demonstrate how community action's comprehensive approach to service delivery results in movement towards an achievement of self-sufficiency. The outcome matrix also provides a framework for documentation and accountability. In this context, you, the trainer, are also I introduced the concept of analysis, a systematic review of the data that allows you to draw conclusions about the client and when aggregated the agency. So that was module 6. Make sense? We don't have anything to put on the wall, but that was a way to introduce you to the matrix. All right, we'll take a break now. We're gonna do 7.
And at least they go immediately to the housing counselors for credit building, asset building, and also financial fitness. So they can learn more about financial management.
What about the 19 years age?
Oh,
Is that a law, state law, federal law?
Yep.
Or DSP law?
You mean for,
You have to be 19 years old to fill out an application for rentals or apartments is what it says.
Give us the mission statement. Who got one they want to expose?
That's a good one.
Yes, yes. Or if not, then I'm going to just
Okay.
point.
I'll throw
Okay,
it out
come
there.
on.
To support families and young children in collaboration with the community child care providers so all children have quality care.
Point out your population.
Families with young children.
Point out your services.
Support.
Point out your outcomes.
Access to quality care.
What's your relationship?
Collaboration with community child
That's
care
very,
providers.
very good. Very, very good. Very good. Okay. Who wants to give us a need? I want to make sure you get this there. That's good. Give me a need. Who wants to give me a need? Off of your logic mom.
I'll give you my need.
What needs you got, Ms. Harris?
Individuals that receive temporary loan modifications often default again and slip back into foreclosure.
Does anybody agree with that need, or does it need changing?
I trust her judgment. That's what she does.
I think you can shorten it though,
Okay.
Okay.
to just almost getting down to your last statement.
Read your last statement.
That was one statement.
And
Just read the end.
The end is default again and slip
Well,
into foreclosure.
you want to prevent,
Redefault.
Say it again.
I'm just
Well,
suggesting that,
her need is just her need.
Yeah.
It doesn't really,
It doesn't
if she
have to be.
deem it as a need, it
Right.
doesn't really need an explanation for it.
That's good.
but I'm taking it from a
What she's
different
talking
perspective
about.
in terms of grant writing. It has to, which I've done a bunch of, it has to be extremely specific.
Well, we just trying to identify what.
Okay, so that's,
Yeah.
yeah, that's why I was saying
Just
narrow.
what I
This
mean.
is
Millions
more,
paying
this is
for it out of
more, this
pocket.
would be
Understood.
more,
Understood.
yeah, this would be more for like a community
Right.
assessment
That's
job.
fine.
Assessment need.
That's fine.
Okay, so Stephanie's giving us, Ms. Harrison
We're on
giving
the
us.
same page.
Okay. Somebody give me one of the outcomes. Somebody, because they've already given us something. Somebody give me an outcome that's on your logic model.
I just used our example then.
What you got?
Which was your point of what we've been doing
What's
all
your
day.
outcome?
Families will have safe and affordable housing. That was our
Okay.
outcome.
You use families will have safe and affordable housing, which is the outcome. Which is the outcome. So we know we consider outcomes before we do services. Somebody give me a service that's on their logic model. I want to hear one service. We're running out of people that we're calling on.
Free transportation.
That's your service? Does that sound like a service? Free transportation? Okay, so that's a service. Need an outcome indicator. We need an indicator to go with that with the outcome. It's Victoria.
With that outcome, it would be documented utilization of free transportation.
Headcount of some sort.
Okay, outcome indicator would be documentation of free transportation. Okay. Somebody give me a measurement, because we ain't got results yet. We get results at the end. Somebody give me a tool for measurement that's on your logic model.
Mine's a different version, but I've got a head count, sign-in sheets, numbers served.
That's good. That's good. That's a measurement tool. Somebody give me a data source. Tiffany, data source off your logic model.
Mine was free after-school childcare, and the data source was a teacher because one of the outcomes was improved behavior.
So your data source is
The teacher,
the teacher?
the report card,
Report card.
the report card,
Report card. Report card.
somebody teacher,
Report card.
yeah,
Somebody give me a frequency
report card.
of the accountability, the frequency that you would use to collect this data. Victoria, give me one. You HR. We know you know frequency.
My whole thing was about increasing the delivery of supportive services to non-native Hispanic populations. Okay, so the frequency was basically daily collection
Right.
of Fax Pro information
Right.
from supportive services staff and interface with partner organizations.
Yeah. And we can collect this monthly, weekly, daily, quarterly. Now, I had y'all to give me some information. We built the logic model all day. I had Angela to put it together. Let's hear how it sounds.
Okay. I guess I don't think I'm start with that mission. Let's just start with the need.
Go ahead.
The need was limited, safe, and affordable housing. Okay, we said our services would be to partner with builders, to create a program that provides financial assistance, and to weatherize homes to make them more energy efficient, thus making them more affordable. That's what we kind of came up with. I kind of put it in different terms. Our outcome was to create more affordable housing and also to establish partnerships resulting in new developments and new housing. Our indicator was that we would have 6 out of 10 in 6 months. 6 out of 10 people to actually obtain or get into new affordable and safe housing. The results would be that we would have 60% of our clients who achieve that outcome. The measurement tools we came up with were, we would look at lease agreements and we would look at the memorandums of understanding. So the proof that we developed those partnerships. The data source would be case notes, where people have come in and we've kept case notes and like she said, maybe sign in, you know, maybe case manage, whatever. Frequency of data would be monthly. we had some other options quarterly, but
Yeah,
I just
quarterly.
put monthly.
Give us the mission.
The mission is to provide resources and services with other human service providers which which resolve immediate needs and lead to long-term self-sufficiency in low-income and vulnerable populations.
Right. Also, that program will be a housing program on the logic model. Does anybody know, is this a family agency or a community need?
It's a community.
It's a community need. Community need. Very good, very good. Was it difficult? I know y'all got to go. I know y'all got to go. Yes, I know y'all got to
Do
go.
we leave the?
Just leave it there. Yes, ma'am. Leave it there.
Leave the books?
We're gonna get some.
We don't get to keep them?
We're gonna get evaluations to you so you can get them back to us on the training. 'Cause we have to turn those in.
Okay.
You're not,
Right.
no, I don't think you really mean that you're
Who do we give the?
sad about not going.
A possibility?
If they did not get refunded, it would shut down.
Was it difficult? Was that difficult putting the logic model together and trying to
No,
decipher?
because y'all are such excellent teachers.
But it's interesting.
Complex.
And it's surprising to hear exactly what you give us after we've presented this to you during the day. It's surprising to know that there are certain intangibles that you pick up on immediately. I mean, immediately, everybody has a strength, and everybody picks them up. But the logic model, we have checklists that we have to go by. And the checklist is used as a self-evaluation of your work. That's all it's used for. It is useful to help you review the logic model and for the completeness of it. The whole completeness of it. It's found on page 102, and I'll read a few of the bulletin points that said, was the mission of the organization or program identified? We need to make sure of that. Was it a family or agency or community box? Check. What was the need? Is the problem, need, or situation statement clear?
It's postponed until 5.
Oh my God.
Welcome back.
All the sources of data, are they identified? Are the target projections for the outcome indicators are realistic, clear, are they attainable? Is the frequency of the data collection sufficient to support the weekly, monthly, or quarterly reporting? We just must realize if we're going to do a logic model, we have a checklist to go by just to make sure that it is accurate. It is for us to evaluate what we put on paper. How will you use it? How will you use the logic model? No response, but that's a question that we have to answer. How will we use the logic model we put together? How will we use the logic model initially when we put it together for EI? Because it just won't be me putting it together. It'll be me and you putting it together. So,
I tried to start working on
so
that.
all of the things on the logic model, we have to put on the logic model. We have to present it and make sure that we can obtain what we put on the logic model.
How does that work though in something like early intervention, which is a mandated federally funded program?
Angela?
How does that work? Well,
Yeah, isn't it already kind of frameworked for you? What the
it is
mission
kind of framework. This is Roma was more or less created just as a management and accountability. So certain parts of it that you could use, like in your, you said your early intervention. That's Head Start. So y'all are able
This
to.
is children
Yeah.
with birth to 3 with developmental delays.
Okay.
Serving
Okay.
children.
So the program is you can't do a needs assessment and determine what the program is already defined for
Yes.
you.
Right, they have to
What you're
qualify.
saying.
And we already
Okay.
We
have.
have federal guidelines.
But
Okay.
that's true for like my HUD housing counseling program. It's the same way. I mean, we don't make the program. It's a federally.
Maybe.
But when you think about management and accountability, you may not can use all aspects of this,
Right.
but you can use some of the aspects of it, like your to analyze your data, to the more or less the part of accountability.
Right.
I think you could use maybe the management has already been defined for you, but you could use your measurement to measure your programs, your data collection, your frequency. You could kind of maybe use some of those elements.
I mean, we have all of this stuff in place. It would just be a matter of formatting it to
Right.
where it matches and it's lined
Right.
up with what everybody else.
And
We're
that's-
taking what we already
Right,
do.
'cause we
And,
already
and
have-
see,
Yeah, I'm not familiar with that program, so I'm sorry.
that's part of us sitting down and understand, you know, why we're gonna plan.
Right.
Because we have to get away from data operations and sit down and plan it out. So that's part of the Roma cycle as well. So now that you're familiar with the format of the logic model, we're gonna move and we're gonna discuss the content that's contained on the logic model and how you use it. And Lakeisha's gonna finish part 2 of 7.
Right, 5 minutes. Or 15.
Wrap it up.
Or 45. Okay, the second part of module 7. Oh, yes, sir. No, I moved that because I had to come over here. Go sit with Andrew.
Model. Since the beginning this morning, one of the first things we mentioned was that we are going to be working on a logic model. We're going to build one since we started the presentation. So we're going to talk about managing performance with the logic model. The objectives on this model is we're going to learn how to construct and use a Roma logic model. We'll identify short, intermediate, and long-term outcomes on the logic models and how they relate to the scales. We're going to show analysis of the data in the logic model that can lead to improved program management and decision making. How the logic models can assist in the targeted process and compare the e-logic model to the traditional logic model. This is the fun part of the training.
Woohoo!
This is the fun part. It has a lot to do with everybody in the room.
I know, just can't get in there.
Yes. Trust me.
Say
Yes.
it ain't so.
Yes. This involves everybody. Using the logic model. The logic model is the blueprint for the CAA, Community Action Agency programs or services. When we're working on logic models in FaxPro, that is the blueprint that we use for each program that we have at CSP. Whether it's with Head Start, whether it's with housing, whether it's with supportive services, every program we have has a logic model attached to it. And it tells a story.
Does early intervention have one?
We're gonna have one after this year.
We go right now.
No, not right now, but next year, early intervention will have a logic model. And it'll have everything that you should have when you produce your logic model today. The Roma logic model can be used in analysis of data, program evaluation, and monitoring of services. Turn to page 96. We built the logic model all throughout today. We started with the Roma cycle. We started with the assessment where we identified the community needs, resources, and agency data. Then we started planning. We used the agency mission statement, and then we identified the results and strategies. We did implementation when we came up with the services and strategies to produce the results. Then we moved to achieving the results with observation and reporting the progress. Then we went to evaluation and we analyzed the data and compared it to the benchmarks. And that's how the Roma cycle starts and ends and starts all over again. Let me see. Stephanie, read those bullet points on page 96, please.
Program operations in columns 1 to 5 of the logic model include mission, need, intervention, projected results, and actual results. Program accountability in columns 6 through 8 of the logic model include the measurement tools, data sources, and frequency of data collection and reporting, including personnel assigned to each function.
Okay, so we noticed that in the logic model, columns 1 through 5 are about program operations. Columns 6 through 8 is about program accountability. So we need to talk about building the logic model. I need someone to read on the next page. What page is that? 97. Ms. Harris, read A through D. You read A through D. Then I'll get Victoria to read the first 4 bullets, and then I'll get Miss Lois to read the last 4 bullets. So you got A through D. She has the first 4, and then she has the last 4.
Okay.
And I have E.
Building a logic model. A, identify the name of the program or service at the top of the logic model. B, identify whether it is a family, agency, or community logic model. C, write the mission statement for the program or service. D, fill out the columns.
Identify the need, problem, or situation to be addressed in column 1. Identify the service or activity that is expected to produce the outcome. In column 2, identify the service or activity, the number of clients estimated to be served, or number of units to be offered, and a time frame. Identify the outcome. In column 3, write the broad statements about the outcome that are expected without numbers or a percentage. Next, identify the outcome indicator. In column 4, write the outcome indicator that matches the outcome in column 3 that you estimate or project. This includes the total number of clients who are expected to achieve the outcome within the established time frame, stated as a fraction, using this number as the numerator and the number expected to receive the service as the denominator.
Moving on, after the service has been delivered, you will identify the actual number who achieved the outcome within the estimated time frame and the actual number of clients who received the service. In column 5, enter the number of clients who achieved the outcome / indicator and calculate the actual percent of success. As in column 4, this is stated as a fraction, with the number achieving the outcome as the numerator and those who receive services as the denominator. Then identify the measurement tool. In column 6, identify the type of tool used to collect or measure the outcome. Next, identify the data sources, collection, procedures, and personnel. In column 7, describe the sources of data, how it's collected, and the staff assigned to the task or tasks. Be explicit and provide detail both for activity inside and external to the agency. Lastly, determine the frequency of data collection and reporting. In column 8, describe how data is collected and reported within and outside the agency. Provide explicit detail and documentation for this process.
And E, indicator for proxy outcome, is used in the logic model. Thank you, Ms. Harris, Victoria, and Lois for reading. Now we're going to build this logic model. We've been building it all day. And one thing I want to see is whether or not y'all get it. We said we've been building it, but I'm going to see if you get it. This is an individual activity. I'll give you 10 minutes to fill it out. And I'm going to tell you, once I pass them out, they're blank. They're blank. We've been building it all day, but these are blank. We started out building it, and I want to see if you can put it on paper and whether or not you can tell me exactly what you're putting on paper and where it goes. But we've been building it all day long. It's all around you. But do you know where it's at? Do you know how to put it together? Do you know what organization goes? Do you know if there's, what's the program name? Whatever program name you give it, that's fine. I need to know whether it's a family, agency, or community logic model.
One question.
What's your question?
Where,
We've been building it all day. That's all I'm going to say. And I want to see if you can put it on paper. Because I know if you've been building it, you understand it. If you can put it on paper, you got it. Yes, ma'am.
Are you expected to have more than one tool for measurement, data source, and frequency?
We're talking about this logic model here. We're gonna capture all of that because I'm gonna get feedback from everybody once they finish it.
Okay.
I'm gonna give you about 10 minutes to put it all on paper, review it, look at it, and then I'm gonna see if we're all on the same page. Because we've all been in the room together today.
You never said anything about a test.
It's not a test.
That's all this is.
I mean,
It's not a test. What it is I want to know if you understand logic models and what goes where and why it goes there.
Let's see.
Yeah.